Hi guys, it's Stephen Halstead with Oasis Senior Advisors. I'm back with another video in our Oasis Cares Network. And today I'm going to talk about the differences between assisted living and nursing homes. It's a big question, and I find that even healthcare workers don't know the difference between the two. So people say to me all the time, I thought they were the same. Well, guess what? They are not the same, and I'm here to educate you on the differences. I would typically be doing this in our community, either at a senior center or a 55 plus community, but we're not able to do that right now because we're all kind of social distancing and keeping each other safe. So I'm doing this to try to help reach some more people who might have questions about these situations. There's been a lot in the news lately about nursing homes, so let's dig into it. So the easiest way for me to describe the difference between an assisted living and a nursing home is that an assisted living community is a housing community that provides care. A skilled nursing or a nursing home is a care facility that provides housing. Okay, can you follow that? So when I explain that to people, it tends to click a little easier in their mind. When I was a teacher, I was teaching kids that had learning disabilities and cognitive disabilities, and we talked about the least restricted environment. We wanted that child to be in the class with as many of their peers as possible if they were able to do that. It's the same thing. We're talking about least restricted environment for your loved one or yourself, so that you can have an independent life as much as possible, even if you need a little bit of assistance. So an assisted living is going to be people who need some assistance with daily care, okay? You may not need a lot, but you need some. Those activities of daily living, or the ADLs that we talk about, are your bathing, eating, dressing, and your meds, taking your meds. Those are the four areas that we really look at. If you have a deficit at all in any of those areas, you're a great candidate for assisted living because people there can help you, assist you in those areas. It doesn't mean you're not allowed to leave your room or allowed to leave the building or that you're locked in a cage. You're not. You have an independent apartment. You can come and go as you please. There's activities and socialization. There's trips. There's all kinds of things. Now, during COVID, it's a little different, as we all know, but I'm talking in general. And so, if you just don't want to take care of your house anymore, it's too big for you or in your lawn and the upkeep, then this is a great way to go. And if you need a little bit of assistance, it's fine. If you need a little bit more assistance, that's okay too. It is there. They will help you determine that. Now, the people who typically go to assisted living are those individuals who want to have a social life, want to meet new friends, still want to sew and paint and have activities and have dinner and lunch and breakfast with friends. And they just need a little help. Maybe they can't remember when they're supposed to take their meds, or maybe they need a standby person to help them with the shower because they've had some falls, or whatever the case may be. Every situation is individualized to the person, and nobody's the same. We are all individuals, right? So then you talk about a nursing home. They are a complete medical provider. They're more of a hospital setting. So you can go into a skilled nursing or a nursing home, rehab, acute, short-term. You've broken a shoulder, you've had a heart attack, you kind of heal and you can leave. That's not what we're talking about. We're talking about the long-term care side of it, where you have so many issues that assisted living can't even take care of you. And you need around-the-clock, 24/7 care from medical staff. That's the difference, okay? You can live in an assisted living and the care be so high that you need those types of things, and you don't have to go to a nursing home. You can hire a home health care company to come in and do it for you so that you can still live in your apartment in an assisted living community. That's a personal choice. It all breaks down to what you can afford and what's best. So this is why we have the conversation with families. No family is the same. Every individual is different. So we have to personalize this, and we want to get you this information so that you make the best decisions, right? So most of the people who go to a nursing home are going to be people who really have that high care need. They're too sick to be at home. They just need supervision and monitoring constantly. They maybe go in and out of the hospital a lot. They might have medical, emotional, and mental conditions. It just depends, okay? So those are your two big differences between the two. So more independent into the assisted living, you have an apartment, you have your friends, you're hanging out, you're getting some assistance, to where in a nursing home, it's a continuous care, higher level of continuous care. Now, assisted living facilities are pretty much private pay. There are some out there who will take Medicaid. But Medicaid in the state of Florida is very tricky. It's different than other states. So if you've moved here from another state, it's not the same. We need to make sure we get you to someone that can help you with that and explain it. But typically, unless you're just low income and can't afford, to pay out of pocket, then that's where Medicaid might kick in. But assisted living, it's a harder row to hoe with assisted living, but it can be done. I have done it. I have found places that take Medicaid. So it is out there. The average cost for assisted living privately would be anywhere in Pinellas County between $2,500 a month for a single person, one room, to close to $6,000 for two people in an apartment. So that's a big gamut there. So don't go, oh my God, I can't afford that. Let's have the conversation. Let's talk about what the assets there are. Let's talk about what the income is. Let's talk about, are there other benefits that might be available? Because there are benefits out there. I'll do a whole other video about that. But let's not rule it out. You have to know your information and compare your apples with your oranges before you can make a great decision. In 2019, the national median cost for a shared room in a nursing home was close to $9,000 a month. Okay? For a private room, close to 10. I can attest to that in my family. So again, it's options that we have to talk about. We have to do a map. I call it painting a picture. I need to paint a picture of you and your family and your loved one, and we look at everything there is, and we start to chip away. We are a free service. Hello. Value to that. Don't do this on your own. If you don't reach out to me, reach out to somebody, because there's a lot of information out there, and a lot of misinformation as well. So people always say, well, which is best? Should I a nursing home or an assisted living? There's so much in the news right now, people. I'm so sorry about everything that's happening. And if you've had someone in your family affected by the disease, whether you're working on the front lines or you know someone that has it, I am so sorry. These are tough times, and things are changing right now, but I'm in tune. I know what's happening. I know which assisted living communities are and are not taking people. I know which ones do and don't have COVID in their building. Just because they have it doesn't make them horrible people, doesn't mean they're not taking good care of these people. It also, same thing with the nursing homes and the hospitals. We're in a whole new world, but please, 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 let's talk about this and plan ahead of time. That's the most imperative thing. I can connect you with resources that can help you. And so I'll talk about those different benefits, talking about elder law attorneys. I can connect you with senior centers and daycare, adult daycare centers, respite, so many things, okay? So please reach out. My phone number is right here on the screen. If you don't get me personally, leave me a message. Also, you can find me on Facebook at Oasis Senior Advisors, Pinellas County. We also have a webpage, Oasis Senior Advisors, Pinellas County. If you search me, you'll find me. It's easy to find. I'm here to help. I hope this information is good for you. Please look for future videos. If you have questions, reach out.